So with healow pay, everything is seamless. They swipe the card and it posts automatically into the patient's chart, which is wonderful. It saves the front desk a lot of time. There is no more forgetting to post that payment to the patient's chart. Finance doesn't have to come over the next day and tell them what they've done wrong and what they need to fix. So we love it.
Healow Pay has been really beneficial for our practice. Prior to using Healow Pay, we were processing on several different platforms. So let's say that I came in today and I had a $50 copay. The front office staff would have to take my credit card, swipe it through the credit card machine, and then manually go into ECW and apply it to my account, which was very cumbersome for our staff, and it definitely opens up the opportunity for human error as we have multiple systems and multiple processes in place. Now with Healow Pay, it's been phenomenal. And so we just started Healow Pay and we're very excited about it on its early returns, because the staff has even commented a number of times. Our PSR staff have said, this is so much more seamless. It's applied instantly. Patients are many times paying for their copays before they even come through the doors, which is really nice. It takes that financial conversation off the table because you see that the patient already paid for their copay before the visit. What we really liked about the system was you get a text regarding your statement, you get the opportunity to go on and pay it, and then if after a certain set period of time, the patient hasn't logged in to make a payment or set up a payment plan, it would then send a paper statement. And it's able to be set up based upon patient's preference to serve them best. And so we've really found a significant increase in patients' ease of being able to pay depending on what they prefer.
There is a 6-day window that the patient has to pay. Well, immediately 11 payments came in. That never happens the day after statements go out, ever. We were beyond excited to see that.